Hello, everyone. Welcome to our Contagion Cultures webinar of Tuesday, October 6, 2020. We're broadcasting from the traditional territory of Anishinaabe and Haudenosaunee. Queen's University was inaugurated here in 1841 by Queen Victoria. Thus, this institution of higher learning that aims to further Canada and the world in a plethora of ways is also an imperial project. I'm grateful to learn and to work here and need to remember this history and strive to right wrongs against Indigenous and many other peoples that continue to this day. I hope that this series, which aims to incorporate and further various ways of thinking about how to best live with all on the planet and with the planet, works in this direction. Contagion Cultures is a Faculty of Arts and Science collaboration between the School of Policy Studies and Languages, Literatures, and Cultures with Queen's University providing substantive support. The circa 50-minute talks are live streamed Tuesdays at 4 p.m. Eastern, and we'll be continuing the series until the end of winter term 2021. So Queen's faculty are more than welcome to contact me, jhosek@queensu.ca, if you would like to participate and contribute to the series. We hope that audience members will pre-register, join us every week, and disseminate the promotional material widely. The talks will be freely available online and archived at the library. We particularly hope that these contributions by Queen's scholars, which are original, will be deployed in courses. Queen's Contagion Cultures Lectures helps to make sense of this pandemic through the expertise and insights of arts and science faculty members. This public-facing series leverages the powerful tools of humanistic analysis to grapple with our turbulent times. For the audience during the talk, please submit questions in the Q&A. The Q&A can be found at the bottom of your screen. You can hover in the middle if you can't see it. And as webinar attendees, you are both invisible and muted, and we welcome your typed questions. Today, it's my pleasure to introduce Mary Louise Adams. Dr. Adams is a professor in the School of Kinesiology and Health Studies, where she teaches about sports, fitness, and movement cultures, and about contemporary issues in sexuality. Her research investigates everyday movement cultures as sites where inequality is both produced and resisted. Drawing on feminist studies and cultural studies, and using a range of interpretive and historical methods, she explores embodiment, the meaning of movement, and the relationship between bodies and social structures with a view towards social change. Her current projects are looking at the political, environment, and cultural history of a municipal park, feminist and utopian ideals in recreational sports, sexual harassment in sport, and the sociology of walking. She's the author of Artistic Impressions, Figure Skating, Masculinity, and the Limits of Sport, and The Trouble with Normal, Post-War Youth and the Construction of Heterosexuality. Her talk today is entitled Contest Over Parks During COVID-19, the Moral Regulation of Movement and Space. And I must say that I find Mary Louise's topic particularly interesting, in part because of its relationships to urban community and urban transportation and mobility, especially now in COVID times. Since the pandemic, urban centers in particular have become sites of contestation about who has the right and who has the possibility to enjoy the outdoors when physical distancing is necessary for personal and public safety. The range of responses has been broad. Places such as Vancouver have turned some streets into active transportation streets for the foreseeable future. Paris has closed lanes on city highways to enable people to get around much more safely than they could by public transportation or by hired motorized vehicles. Our city of Kingston, where Queens is located, has neither supported citizens' continued requests for street calming to allow more people to get outdoors, nor supported our idea of more physical barriers and ventilation on buses to protect drivers in particular. Meanwhile, many work-from-homers around the world are experiencing personal openings of mobility privilege. Liberated from their work offices, they're buying or renting in the closest, most COVID-free and broadband full surroundings possible. Thank you in advance, Dr. Adams, for your insights on the coveted and contested spaces of parks in these COVID times.
That's a good way to start. Thank you. Thank you
Thank you.
for your organizing and for this series.
My pleasure, as always.
I just saw the coolest thing. I saw that Karima Dorney is a guest at this event, and that's making me very happy. And not that I'm not happy with everybody else, but I'm especially happy with Karima. I'm apologizing in advance. I have a dog that has been asleep all day and seems to have just woken up, and she might like to share this public space with us. Okay, I'm going to share my screen, I hope. Okay. All right.
It looks great.
Okay. Different title, a little background, excuse me, before I get started. Since 2012, I've been involved in advocacy around Bell Park, the former marshland turned city dump, turned golf course, turned natural park that sits on the Cataraqui River here in Kingston. Over the past couple of years, this community work has been transforming into a scholarly interest in the history of Bell Park and the history and role of city parks more generally. And so in the early days of the pandemic, when stories and debates around parks were showing up daily in my newspaper and in my social media feeds, I was inclined to start paying attention. Before I go any further, big thank you to Dr. Jeanette Leroux for discussions around this. There's a paragraph, there's two paragraphs I've basically cribbed from a little project we started working on in the summer. There's been research assistants from this list of undergrad students, 3 of whom were summer students, and 1 who's currently doing an independent study around some of these issues right now, and I really appreciate their work. Okay, so in the pandemic, we started, this is actually a paper newspaper that ends up like on the table and you can read it. Lots of stories and images and representations of parks. It seemed like parks were were being used in a way to signify and symbolize some of people's experiences and concerns about the pandemic. That's from the Kingstonist here. Now the best media source in our town. City TV, the Wig. This is the gates of Trinity Bellwood Park in Toronto, and a little image from Global News. And yeah, so at the end of March, the provincial government declared a state of emergency and municipal governments followed suit. Cities closed facilities and programs, among them tennis and basketball courts, soccer fields, baseball diamonds, playgrounds, and other outdoor recreational amenities. Parks generally remained open, but permitted uses were severely restricted. In some cities, the only permitted use was walking, and that walking needed to be restricted to paths. Resting on a bench or standing or sitting on the grass, even while alone, was prohibited. Public debates over the restrictions on park use became one of the flashpoints of competing views on the public health emergency and how best to manage it. They also presented a range of views on parks, public space, public health, and how to construct a more just and vital post-COVID future. In this talk, I'm going to speak about 4 of these representations of parks, for which I'll offer a little bit of context. I will conclude by picking up on some of the conversations that I've had access to about possible ways to transform public space in a post-pandemic world. So here's our 4 ways of thinking about parks. My aim here is to use parks as a means of framing the social relations and structures that the pandemic has laid bare. And I want to use parks as a means of thinking about how those social relations and structures need to change. Parks provide a way into questions about the value of public space and how, moving out of the pandemic, we might be able to envision public space differently, better, as a contributor to more equitable, healthful, sustainable modes of collective urban life. Parks are typically seen as spaces of leisure where we're free to recreate as we choose. A day at the park equals a day of pleasure and freedom. Parks signify enjoyment, a means of escape from work, from the built environment, maybe even from family. Yet parks are heavily regulated, governed by rules about dogs, alcohol, noise, sleeping, smoking, the timing of certain activities, the way one might interact with plants and animals. In Kingston, for instance, you may not ride a horse in a park, nor teach someone to drive in a park, nor carry a boat through areas that are not defined as areas through which you may carry a boat. You may not create a nuisance, plant an unauthorized tree, install a fence, or engage in unauthorized skating. The history of parks is a history of control of nature and of the behavior of people. In the 19th century, the process of emparkment, that is turning land into a designated, well-bounded park space, was tied to reform movements intended to improve urban space and the people who used it. Parks were designed to contrast with the city around them, to help curb deviance and decay caused by industrialization and rapid urbanization, to serve as tools of socialization and remediation. In learning to behave in accordance with the rules that inevitably followed park making, the 19th century park goer might also learn respectable values. In this sense, writes historian Karen Jones, a newly established park served as, quote, an outdoor reform school, a teacher of morality through health and leisure, unquote. How much better middle-class urban reformers might argue for the laborers of the 19th century city to stroll through well-ordered parkland than to engage in cockfights or to visit the tavern. Underlying park regulations are specific ideas about what constitutes a park, what parks should do, what their value is. But even more fundamental to their operation are ideas about how cities should work, how they should be organized and governed, and to what ends. These ideas have, of course, changed over time. At the risk of sounding like a functionalist, parks are part of the larger apparatus through which the inequities and pressures of municipal life have been managed. In the 19th century, emparkment was seen, at least in part, as a remedy to poor living and working conditions of laborers, a means of staving off potential unrest, but also assimilating all classes of people into the dominant values of the middle class. They were also part of a broader movement toward public health, along with zoning bylaws and municipal sanitation infrastructure. In the 1950s, so we've moved ahead very quickly here without warning. In the 1950s, cities expanded park and recreation services as part of a widespread post-war concern with juvenile delinquency and deviance. In the present day, we are more likely to talk about parks using the language of health and well-being, but we still make arguments about the role parks play in cities and the people who use them, and these arguments are shaped by the cultural and political values of our times. This is one of a huge series of photos of cherry blossoms that were in the Globe and Mail, and I don't know if people are familiar with the cherry blossoms in High Park in Toronto. I used to live a block from them. They're spectacular. The park becomes very crowded every year when the cherry blossoms are in high bloom. And so fences were put around that whole large, huge part of High Park. So the Globe and Mail, I think, had it was the cover of the newspaper, but it was also a huge 2-page, very beautiful spread of the cherry blossoms that were locked up behind fencing. So parks as sites of regulation. Immediately after provincial emergency regulations were announced at the end of March, municipalities announced restrictions on the use of parks. According to one national survey, 22% of cities closed parks entirely, while 78% closed amenities but kept green spaces open. 41% of cities increased the presence of bylaw officers in their parks. In some cities, not ours, efforts to enforce park restrictions led to heavy-handed policing, or not ours, I should say, not to my knowledge, not ours. Efforts to enforce park restrictions led to heavy-handed policing that seemed not at all related to principles of public health. Ontario, Quebec, and Nova Scotia saw particularly aggressive enforcement. According to a study called Keep Off the Grass that was put out in June by the Policing the Pandemic Mapping Project and the Canadian Civil Liberties Association, more than 10,000 tickets were issued across Canada between April 1st and June 15th, for a total of $13 million in fines. Most of these tickets were issued in Quebec, where the fine for contravening emergency regulations was $1,500. In Ontario, the fines were $800. People were ticketed for walking their dogs on their own, away from other people, for resting alone on benches, for stepping on the grass to let someone else pass by. The report suggests that racialized people, queer couples, and people without housing were disproportionately targeted by the law, by bylaw officers. One of the key messages of the HIV crisis has been that public health is not fostered by policing. HIV activists and service workers learned early that changing long-standing behaviors is hard, even when the risks of not changing are great. As anyone who's tried to diet or go to bed earlier or engage in more physical activity knows. The way to achieve behavior change, like public health scholars tell us, is through education and goodwill. Punitive measures, given the racist and in other ways inequitable history of policing, disproportionately affect Black, Indigenous, and other racialized peoples, people who are poor or who live with disability, who are visibly trans or queer, or who have obvious mental illness. Public response to the overzealous policing in parks was swift. Critics argued not just against the excessive enforcement, but also for less restrictive measures in parks, so that people might benefit from parks as health resources. Especially during phase 1 of the pandemic, people needed to be outside. They needed to move, they needed space, and they needed to see other people doing the same. In Kingston during phase 1 of the pandemic, city residents lost, and I'm thanking Jeanette Leroux for these numbers here, lost access to 13 sport fields, 8 indoor rinks, 60 playgrounds, 15 yoga studios, 21 dance studios, 3 indoor soccer bubbles, 15 small gyms, the gyms and exercise rooms at Artillery Park and the Invista Center, and the athletic centers at Queen's, St. Lawrence College, and RMC. For a brief period, we also lost access to Lemoyne's Point, Little Cataraqui Creek Conservation Area, and the Cataraqui Multi-Purpose Trail north of the city. These public and private facilities make a massive contribution to the overall health of our community. In their absence, parks became an especially valued public health amenity. That's also in Hyde Park. There's a vast literature on the value to health of parks and green space. And I won't rehearse all the findings here. Well, the idea that urban parks are healthful has been central to their design since the 19th century. The notion of what health is or what people need to be healthy has shifted. One of the motivations for early parks was to provide relief from poor quality housing and urban industrial pollution. You read about fetid air, smoke, the smells of sewage. Parks were to provide ventilation, and hence the famous phrase that parks are the lungs of the city. When I was a child, we were admonished constantly to go outside to get fresh air. There was no additional instruction on what we should do when we got out there. Being outside was the point. This was the era when you might put the baby outside in a stroller for several hours every day, as my mother did with my older sister, even in Ottawa, even in the winter. I used to assume this reification of fresh air was a product of the history of TB. But now I wonder if it might also be related to my parents having been born immediately after the 3 waves of the 1918 flu epidemic. Today, we're more likely to see parks as spaces that provide opportunities for physical activity, which we understand contributes to physical and mental health, which of course are not two separate things and should not be divided as I have just done, but that's what we do these days. Health research has long espoused the psychological, social, physical, and immunological benefits of physical activity for people of all ages. A burgeoning subset of this literature outlines the particular benefits of physical activity out of doors. Researchers suggest that there are several psychosocial mechanisms that underlie the health benefits of being active outside, including increased restoration, increased personal restoration, like physical restoration, stress reduction, greater number of social contacts, and a greater sense of social inclusion and social cohesion. Related research has demonstrated by contrast that less green space in people's living environment coincides with feelings of loneliness and perceived shortage of social support. And I looked at something last night that kind of blew me away. There's a researcher at the University of Guelph, his last name is Moulas, that even when they're talking about green space and greenery, some of you have probably heard about a study where even putting pictures of greenery in hospital rooms seems to have beneficial effects for people's recovery. But in terms of urban planning, the research from Guelph, even as little as planting 10 trees along a city block. So we're not talking about big, huge swaths of land. Just adding some green to the city can help. It's this latter point that's perhaps most important during the pandemic, and especially for people who live alone. Parks put us into proximity with other people, a key benefit to people's sense of well-being during this long period when many people have been isolated at home. The tendency to advocate for parks for reasons of health rather than for, say, moral uplift, as a 19th century reformer might have done, is not new. But it has been increasing over the past few decades, as we've seen in the realm of government shrinking, the size of government shrinking, in relation to recreation, the expansion of user fees for what used to be considered necessary public services for all. In Kingston, 8 years of public debate about Bell Park were launched by a staff report and a suggestion from the previous mayor to remove public recreation activities from Bell Park's 88 acres of waterfront land in order to turn it into an industrial solar farm. In the face of such thinking, claims for the health-giving properties of parks make sense. Arguments about health are a way of shifting the grounds of public debate and bringing an issue into a realm that clearly demands government intervention and support. And of course, there are health effects from green space in parks, though these are not equitably distributed, as I'll mention below. The parks equals health argument can sometimes also keep our focus too firmly on the human park user rather than on the ecosystem and the plants and other creatures that inhabit park spaces. As an example, sport involves activities that are said to promote human health, a claim questioned by sport researchers all the time, but it's one we frequently hear in the context of municipal recreation. But sport involves practices and requires facilities that compromise biodiversity, limit the capacity of the city to address climate change, for instance, by covering a large piece of parkland with trees rather than grass and soccer lines. That said, it's hard to argue against health and health promoting amenities and services during a pandemic, especially when other means of promoting health have been rendered inaccessible or unsafe. Indeed, a group of epidemiologists and medical researchers in California, writing in a journal of pediatrics, suggested this past May that we do well to declare parks as essential services during the pandemic, a designation that could also ground calls for emergency funding for maintenance and staffing. However people are making sense of their behavior, it does seem that they are, whether they're using health language or not to make sense of their behavior, it does seem that they are visiting parks and trails more than they would usually. An attempt to park at any trailhead on a nice day will make that point near Kingston. Parking lots are full. Cars are parked all the way down the road usually. But researchers have also found this to be the case more broadly. Park People, a Canadian advocacy group, conducted a national survey in June related to park use during the pandemic. The researchers talked with 1,600 people, 51 cities. 55% of the cities said that park use had increased. 82% of the people surveyed said that parks had become more important to their mental health. 38% said parks had improved their sense of social connection, with that figure rising to 48% for people who live alone. 64% of the people surveyed said they felt anxiety, though, about leaving home during the pandemic. Their specific concerns about visiting parks include inability to social distance, the lack of washrooms, and don't forget all the washrooms in all that outdoor, there's a couple open in Kingston, but most of the washrooms in outdoor facilities have been closed. This prevents a huge swath of people from being able to go out. Uncertainty about park rules and whether you're going to get in trouble or not. Social judgment from other users, and what the elaboration here was talking about, social judgment about whether you were following park rules correctly or not. There's a lot of moralizing judgment, both in person, but also on the interwebs, as probably we've all seen. And a fear of ticketing and policing. which given the earlier zealous enforcement is not unfounded, particularly for people who, in racialized groups who feel they're being over-policed. The growing appreciation for parks during the pandemic in some ways obscures the fact that parks are not equally available to all. A significant body of literature has shown in both Canada and the United States that access to parks correlates to conventional social and economic hierarchies. Poor neighborhoods are less likely to have parkland or the kind of park amenities found in more affluent areas. Good access to park resources correlates really tightly with income. Park equity involves both the accessibility of parks and the quality and size of park spaces. One of the things we have learned in Kingston is that public pressure can have an influence on this aspect of park politics. Bell Park is one example, but the Memorial Centre is another. In the early 2000s, and I just want to say the Memorial Centre over the course of the pandemic has been one of the most animated spaces in the city, and the uses of that space have been pretty different than they normally would be. You're seeing people in organized exercise classes out in the field, very socially distant or physically distant. See lots of people using the stairs for exercise, lots more people walking than normal. It's there's a lot more people there doing a broader range of activities than normal. In the early 2000s, the Memorial Centre grounds were in a relatively neglected state due to, well, neglect by the city. The park was therefore very underused, a fact used by the mayor, a different mayor than proposed solar panels, the one before that. This was a fact used by the mayor, who suggested that the 23 acres of parkland between the arena and Concession Street should be sold off to a housing developer in order to pay for what is now the Leon Center downtown. And of course it's empty right now, but it is empty most of the time. Michaela Hughes, who's a local architect who used to live around the corner from the Memorial Center and was involved in some of the activism around the park, mapped all the parkland in the city and basically was looking at the amount of park per person in the different neighborhoods. And she found, unsurprisingly, that Williamsville neighborhood, where the Memorial Center is located, was underserved in terms of the amount of park space per resident. Indeed, the Memorial Center was the main park space for that whole neighborhood. The quality of that park space was also, as a visit to any other neighborhood would have shown, well below expected local standards. The outrage over the mayor's statement, the city's history of neglect in a modest, as of yet, ungentrified neighborhood led to a lot of advocacy and activism that resulted in the much improved park of today. Inequality in access to parks in normal times means inequality in access to parks during the pandemic. Park access is a health equity issue and environmental justice issue. The increased need for parks during the pandemic will be better met in neighborhoods already well served by parkland. The people who most need outdoor space in so-called normal times will be those in most need during a pandemic. People who do not have private yards or tranquil streets, people who live in crowded housing. Whoops. Finally, parks as homes, thinking about parks as homes. Finally, and related to this notion that not all people are well served by municipal parks, we need to think too about parks as places to live. Early in the pandemic, it became clear that the city was ill able to address the pandemic-related needs of people without stable housing. The city in general is unable to respond to the non-pandemic needs of people without housing, and that inability was magnified with the health crisis. In March, the city evicted campers from the Market Square who were camping right in behind City Hall and from other parks, encouraging those people to move to this parking lot at Bell Park, where already there had been porta potties were there. There were porta potties put around in different parts of downtown neighborhoods, and there were porta potties already in the park. There's obviously this big space, And of course, Bell Park is not in one of the most affluent neighborhoods of the city. That's not unrelated here. Over the course of the next few weeks, more people moved to Bell Park. Social service and community sport groups started to work with the people who were camping there, and the city started to provide some services: garbage pickup, eventually electricity, water, and wireless. The people in Bell Park formed a community, organizing themselves. They connected with other community members with the mutual aid Cataraqui, and with support services like HARS, Street Health, and some of the other community organizations. The organized into a community, it was easier for people to advocate for their needs. And the reports from some of the service organizations and the people who were working with the people who were camping is that people who hadn't previously used or engaged with services like harm reduction services or mental health services started to do so once they were in kind of a stable situation for more than a little while. Among local debates related to COVID-19 and parks, the one that revolved around the response to the Bell Park community was perhaps the most heated. Advocates for the campers talked about the changes that a few months of stability have led to. There were some really nice reports by some local doctors who were working with the people in the park. There were opportunities in a number of ways for different groups to connect with people in the park who maybe wouldn't have done otherwise. And so there was some community organizing done that certainly educated people about the situation for people who don't have homes, and also what the situation is like in Kingston, what the services are like, what the programs are like, and so on, and what the problem was with the city's response during the pandemic. Those who were opposed to the camping in Bell Park talked about competing interests with traditional park users and neighbors. They worried about the harm the campers might cause to the park itself, from fires, wood cutting, and garbage, things that of course happen in Bell Park every summer, whether there's an encampment or not. On September 1st, after a vote by City Council, the people camping at Bell Park were forcibly removed from what had been for 4 months a home. What would it mean to be able to shift discourses about parks to enable us to think of home as one of the many definitions that have been opposed on city parks for the past 150 years or so? I think in this case, a lot of us hope that the health argument would be, and the serious health crisis would be enough to cause real change in the cities and most cities' approach to homelessness. If we can't accommodate the most vulnerable citizens during a pandemic, when might we be able to do that? If we can't address homelessness as a health crisis during a pandemic, when might that happen? When the language of health is used for recreation and sports and baseball, why can't it be used for to construct a home for people? Again, let's not forget that people who are marginalized to begin with are more likely to be unhoused. Indigenous people, people with mental illness, people with addictions are disproportionately finding themselves in a category that has them over-policed and underserved and in danger, often in danger. Of course, the irony of the camp at Bell Park is that some of the people who were staying there talked about the park itself, its own efforts at rejuvenation after years of neglect and misuse by the city. The park itself provided some respite and feelings of well-being for the people who were living there. So to conclude, it's hard always to think of what to do with a kind of collection of thoughts here. But for me, this project of this paper has been to think about some of the ways that parks are shaping experiences of the pandemic, but also our ideas, how parks are making visible or helping make visible our ideas, or helping us express our ideas, I guess, about the structures and social relationships that are producing the pandemic in certain ways, and in certain ways for some people and other ways for other people. I also wanted to think about our experiences of parks, because shifts in public understandings of parks during the pandemic seem to have prompted discussions about how we might organize, design, and use parks and outdoor space and public outdoor spaces more generally moving into the future. Public disgust at overzealous policing and the too heavy restrictions, especially in parks, which we tend to think of as places of freedom, have led to interesting discussions about harm reduction approaches to physical distancing. How can we design ways of living among other people that will be able to sustain over long term if we need to? Access to outdoor public spaces needs to be part of that project. In Kingston, we've seen efforts to increase our access to public space with the lane closures for cafes downtown and the Quiet Street projects. Those are strategies that have been used in other cities, and Kingston was adopting projects that were programs that were used in other cities. It took a lot of advocacy for people in the community to do there. But what might we be able to do that comes out of our own community about the land where we are, about the resources we have here, about the specific needs of people that are here? Other suggestions for safe access to public spaces over the long term. And this is thinking about the people in the early days of the pandemic who were nervous about going outside, who were nervous about passing other people on trails and so on. What about using more of the clock? We said that when we were talking about building the bridge in Kingston. What if we used more of the clock and everybody didn't go to work at the same time? Maybe we wouldn't need a bridge. But what if we used more of the clock in terms of recreation? What if we used the night? What if we were out of doors more hours of the day and spread ourselves out more in terms of time? In cities where there are still municipal golf courses, you can read about advocacy campaigns where people have been pushing to turn those municipal golf courses into urban farms, which would be incredible, or at least into sites where people can engage in less costly forms of public recreation. And finally, a few random questions. Will the pandemic lead to more explicit expression of health criteria in park and recreation planning? Current planning documents always mention health benefits. Any of us who have done any advocacy around public space or access to public space or parks or recreation facilities, you do not stand up in front of city council without saying, oh, this is good for the public health. But where's the accountability on the back end? I don't want to use that word, that's such a neoliberal word, but how could we actually make sure that the planning process and the design of parks and other outdoor spaces or recreational facilities, that health is actually, or I don't know, we need a different word than health too, is actually part of what we think about when we make the decisions about them, that it's not just kind of a keyword that we use for rationalization. Health criteria, for instance, might mean more woods and play spaces than soccer fields. It might mean different kinds of open spaces. It might mean open spaces that are accommodating humans and other creatures and plants and forms of life, with a recognition that health is something that's not just about us in the immediate here and now, but it is something about a long-term relationship that we have with this place where we're living. Right now, the COVID-related policy changes are about managing the risk of infection. What would a more preventative approach to recreation planning look like, knowing going forward that pandemics are things that, yes, can actually happen here? Will the threat of future pandemics shift recreational facilities towards less organized individual uses, for instance? Will we move, it sounds like I'm picking on sport fields, I guess I kind of am. Will we move away from sport fields and the kinds of organized recreation that serve a fairly privileged part of our community? We also know that sport participation figures have been going down since the early 1990s, and that the people who are most likely to be involved in organized sport, particularly as the level goes up, are people who are very economically privileged. So But what we know during the pandemic is those kinds of forms of organized sport, we can't engage in them during the pandemic. So do we try to design our recreational facilities to be there and ready? So more walking trails, more green corridors moving through the cities, more connection between neighborhoods, and so on. And finally, already the planning literature is starting to ask about new approaches to public space. And they're talking about parks, but they're also talking about many other aspects of public space, including just sidewalks and downtown spaces. So when we're thinking about public planning in general and parks planning specifically, you know, it's clear that parks are going to be part of this story, but are they going to be parks that are different than we're used to? And how do we make them parks that will play some kind of key role in helping construct a more equitable community and more just relations among people in the community and among the humans and the other plants and creatures and the ecology here. And thank you. And Violet, who has been singing in the background, she thanks you too for listening to all her singing for this entire time. Yes, thanks.
Thank you so much, Mary Louise, for that very interesting and multi-layered discussion that gives us much more multifaceted way of thinking about parks in general, also with the historicizing look, as well as in the particular circumstances in which we find ourselves, that as you also, I think, wanted to emphasize, even though we probably should have been planning for it, we were never really planning for it. So on one hand, you know, the public officials doing the best that they can under the circumstances, and then the downsides that maybe, you know, inadvertently came out of that. But if we have time for my questions around that, then we'll go there. But first, let me take a question that we have in the chat that you might be able to see as well, Mary Louise. By Dan Gale, I was interested in your statement that an epidemiologist suggested that parks be deemed essential services. If by chance such a designation were made, or maybe some other formal designation, do you think the degree of regulation would increase, perhaps narrowing use or narrowing access? Are there regional examples of parks formerly deemed to be lightly regulated?
In terms of this idea, thank you for the question. That's a good question. And I was exposed to this idea, I have to say, within the last 24 hours. So the notion of essential services, during the emergency, there were resources available for things that were deemed to be essential services. And I think the argument that the people were making in the article that I read was that, and particularly, and you know, almost everything about parks is written about large cities, right? The literature does not focus on the mid-sized or small city like Kingston. You know, if you can write an article that's not about London, New York, or even Toronto or Vancouver, you know, they barely exist. Studies of smaller places. So they're writing from San Francisco. I'm pretty sure they were in San Francisco. And the notion that parks needed to be available as specific health resources is what they're trying to get at. And so they were actually thinking in terms that the designation of an essential service would mean that you could keep parks open more because you would have access to resources to pay staff and to organize the kind of thing like the signage and the dividing people off from each other in different directions and so on and that sort of thing. Anytime you start imposing regulations, even if it seems like it's for good reason, you're going to start possibly getting unintended consequences. And so if something is considered an essential health service, rather than all the other meanings we make out of parks, is that going to shift the way people are able to use them or the way people might be policed or surveyed because they're participating in a health intervention then, rather than just going to the park like they might do. So, yeah.
It would mean that parks then would be open though, right? I mean, I know about the bicycle shops. We were worried that they wouldn't be considered an essential service, and that would be of great concern to people who get around by bike commuting. And happily, they were considered an essential service, much as a car repair store is, and that was an important, let's say, concession, I guess, on the part of governments that furthered the safe transportation for people during the pandemic.
Yeah, yeah,
yeah. So, Mary Louise, I'm so intrigued by your talk because of the way that it feels to me like it's so anti-regulation, and it's kind of surprising to me almost. I feel myself kind of comfortable with a bit of regulation, perhaps because I look across the border, being a dual citizen and seeing what's going on where in a country whose own president won't wear a mask in order, won't follow a regulation in order to protect people immediately around him for whom they're working for him, and they basically can't avoid being there. So it feels like, wow, can't regulation sometimes be a good thing? So that's kind of, I'm not sure how much you want to address that, but I think that if you have time, it'd be interesting. Then the second thing that I wanted to talk about was if you could compare the difference between, let's say, the decision to keep bars open and then the decision to close parks, which might have not happened at exactly the same time, and that might have been the reason for it, but there also seems to be something behind that you might, I think, want to talk about. And then I hate to do this, but I'm going to do the chain questions, but you can cherry pick. The last one is the question of people making parks their home. Because I, as a very bourgeois woman, I don't feel very comfortable using a park when there are homeless people or people without homes living there, even though I understand the need for a good place for them to live. And I wrote in support of people being able to stay in the park precisely for their health and also for the health of the entire community. And isn't though the answer more that a park should be something that is for everyone to enjoy, and the reason that people don't have homes needs to be addressed, not by giving them a park to sleep in, but rather making it possible that for them to have a home and then use a park like the rest of us.
Yeah,
I'm done.
Let's do the last one because I can remember that one right now. Yeah, like the real aim here is for people to have homes, for people to have places to live, for the city to actually take the city, the province, the federal government, everybody to take housing seriously as an issue that was absolutely made visible to people during the pandemic. And the other thing that was made visible in some ways, but maybe could have been explained better, or the efforts, why did people not want to partake in the efforts that the city had made to like open up pandemic related housing way out in either the East or West End or something like that. But some of the structural constraints on why that wasn't possible for people. So the thing about her, oh my God, she is so noisy. I can't believe it. She's been quiet all day, of course. So the thing about the being uncomfortable in parks, if they're, people are camping in the parks, I totally get that. But I have to say this summer, there's been people camping in Bell Park ever since the developer, Jay Patry, fenced off the big piece of tannery land where a lot of people used to spend the summers previously. Very toxic piece of land. It's probably not the best place to be living, but you could be very concealed. You could have private places. And it is also very beautiful, like really. And so when that got fenced off by a private developer, people started moving out into different parts of the city. You would see tents all over the city where you wouldn't have seen them before. I actually felt safer this summer because I wasn't going to be walking around a corner kind of stumbling on a tent, kind of hiding somewhere, and I wouldn't be surprising somebody. I also think that my discomfort as a nice middle-class lady who walks her noisy dog in Bell Park should not take priority, as you said, also over people having a place to live. But really, you would have hoped that the visibility of poverty and need in our city would have generated something other than just an eviction notice. And so there is the organizing now around the social services hub for Montreal Street. So that's one thing. Should I go on or should we go somewhere else? You are muted, Jen.
I think you'll have time for both of you, mine, but I'll read you can you talk about the kind of research that social science and humanities researchers might do that would be helpful to the goals you outline in your paper?
Yes, I can. So there would be, and humanities researchers too. So first of all, we need to understand, and it's not like people have not done this, but I think understand how people use and make sense of the public resources that are available to them. And we need to do that at a local level. And in Kingston, we have massive public engagement processes that some of us have been involved in and some of the people in the participant list. But this is not a survey of the people who might be using a park in their community. This is people who are experienced and confident about going to city meetings and saying their piece and writing letters. And so the city gets points for public engagement. We get tired. Sometimes they listen to us. And I think, it's very complicated. It is, in many ways, it's a performance on all the sides. Have discussions about what's happening in some of the public spaces change? Yes, they certainly have. Like, we had a big influence on what's maybe going to happen at Bell Park. I think the pandemic is going to have what's going to happen at Bell Park because of the pandemic is maybe fantastic. Like, the pandemic, I think, is good for Bell Park in terms of the actual land itself. So actually finding out what people in a local area want. The other thing is looking historically at the spaces and how the use of the spaces have changed. That's super important. And I guess the third thing would be to actually do research with decision makers about what is it that guides some of the things that they seem to do repeatedly that must be being guided by policy documents or particular processes or practices that they are required to do, and to see where we might make interventions to shift what seems to be the constant repetition of similar kinds of decision making.
Do you feel like taking a stab at the open bars, closed parks phenomenon?
I do think that they were not chronologically simultaneous, right? And so, but the closed park thing, and Kingston was actually way better than many, many places, I have to say. And the stuff about the trails and the closing of the trails, it was like the public health officials who went to the conservation authority and said, like, you guys don't need to do this, like the discourse around harm and crowds and probably a few complaints about somebody who saw a few more cars in the parking lot than they did made the conservation area nervous in a society that likes to place blame in some ways. So I think they just overreacted. And I think what we did see in terms of the trails was a really appropriate response from the public health people, pushed on by some of the city councillors who were, of course, then pushed on by some humans who live in the city. So that certainly helped. And the parking lot thing, the change around, so if you go to a piece of trail for 10 years and you only see 3 cars in the parking lot, and then you go one day and you see 12 cars in the parking lot and you have to put your car on the road, it's a very different, but still very small thing. It's very different circumstances, and people, I think, might have freaked out, like, oh my God. And yet there's 10 kilometers or 5 kilometers of trail in front of you for those 12 cars to be stretched out on. So I think change and the general anxiety, and the media's whipping up anxiety, and nobody knows what's going on. And these are in the early days. Everybody freaked out, and maybe some of the park officials freaked out a little bit too much, but then walked it back. The opening of the bars,
Well, I'm fascinated by the question of the opening of the bars, because from experts in Canada, but also experts in Germany, there's been so many discussions about to keep the curve, to lower the curve, to keep the reproduction rate down. We need to because we are aiming to go into schooling, right? And this was during the summer, aiming to go into schooling in September. In order to get it down low enough, we have to just stop this close recreational activity. But that just, there are no countries, to my knowledge, that are the ones that are continuing to struggle now. Traditionally sort of European and North American and the Americas, many countries in Africa, doing poorly because that decision couldn't be made, because it was, because I think it's because there are different pocketbooks speaking, and the question of how to, mitigate the economic problems, whether it's a wealth tax or whether it's, going to be having people going into bars, is what was the determining factor, rather than the actual public health aspect of it.
Well, and I think one of the discussions that was around our dinner table early on is, there was not a lot of discussion from the left about the health impact of the economic crisis that's going along, like that. Economic inequality, an economic crisis that also has health impacts, right? And so I don't think this is necessarily where the opening of the bars was coming from, but the desire to have people working is not, I don't think, a bad desire, but it might not always be possible in a pandemic.
Yeah, you're right. So, because you could have different solutions, like a guaranteed basic income, or like Canada was solving it with CERB and so forth. So I'll abruptly switch, because I see that we're near the end, and Elizabeth Hansen has a question about horticulture in parks. I long for public gardens, which Kingston seems to have no interest in. Formal beauty seems like a resource for mental health. And Elizabeth Hansen's curious about your thoughts.
I think so, yes. And I'm imagining some of the places you are imagining. I think the ability to have a range of different kinds of green spaces and park spaces in a city should be able to accommodate this, right? So whether it's like horticulture in big urban agriculture way, like the park at the end of my street could have food growing all around it. It could also have ornamental native plants if you want to constrain the kinds of things. But the notion that there could actually be some aesthetic value in horticulture, or horticulture as art, or that we would actually want to think of some ways of having different versions, what different groups of people think is beautiful. Of course, we should be able to accommodate that. And, we could accommodate it also, even like there are, it is something that once upon a time would be a project taken on by the city, but we don't do that sort of thing anymore. But it would be the kind of project that could also be taken on by incredible gardeners, right? You know, there's that little triangle of public garden on, you know, in Portsmouth, when you're coming along to go onto Union, there's a little, that's managed by the community, and so on. And that kind of, you know, if you're the rugby club and you want to do a private public partnership and take over half of Bell Park and put your rugby fields down, the city's all about it. But if you're a bunch of, you know, incredible gardeners with interesting artistic and aesthetic ideas that, yeah, you know, maybe could change periodically if we didn't want to impose one aesthetic on the city, then it's a little bit harder to get anybody's ear. But that's why guerrilla gardening exists. Find your little patch of place and take the seeds you didn't plant this year and stick them somewhere and keep doing that every year until you have something really good.
That's a fabulous way to end the talk. Plant seeds until you have something really good.
Yeah, that's a good idea.
So thank you for a very, very interesting talk, and thank you all the participants. Thank you for the people that asked questions, and please join us for further Contagion Cultures. And if you'd like to participate and you're a faculty member, then let me know. Thank you again.
Thanks for organizing us, and thanks to all the people who took an hour out of their day. And I apologize for my talk.
It fit the theme of the talk, you know, sharing with other species.
Yeah, that's right.
Thank you.
Bye.